All right, Rex, thank you so much. Pine Belt, joining me now is Dr. Megan Lott. She's a rehabilitation optometrist, and she's here today to talk to us about Low Vision Awareness Month, which is the awareness for February. And so you have a few topics that you want to tell us about, but first tell us what is a rehabilitation optometrist.
So we look at the functional vision of a patient. So a lot of times whenever we think of eye care, we just think how well they can read that small eye chart that's all the way across the room. A lot of patients, they can't do that. And all they want to be able to do are the simple day-to-day tasks like reading, watching television, even driving a car. So I brought a few different demonstrations on how we do a low vision evaluation for these patients.
Okay.
So one thing we do is instead of looking at an eye chart, we can use numbers. This is called a fine bloom chart, and you can see it's really, really large. And so we're able then to gauge and accurately assess a patient's visual acuity using this. Off of that information, a rehabilitative optometrist is able to understand how much magnification that patient may need to read small print, to be able to see a television, to be able to drive a car within the legal limits of Mississippi.
Right.
And so the main goal is when there's not a lot left to do for the eyes themselves, there's almost always more you can do for the patient to improve their quality of life and their independence.
Okay, so you have some props here to show us, and you wanted me to try on one. So are these different levels of helping the patient visualize or see what they need to see in their day-to-day?
Yeah, so whenever we are doing a low vision evaluation, the first thing I always ask a patient is, what is it you want to be able to do? Where are your limitations? What are the day-to-day skills that you need? Do you live alone? Do you need to be able to see medicine bottles, read your bills, that type thing? So they might just need something for reading, which might be a device like this.
Now, those are some thick lenses.
Yeah, so you can tell they do not look like normal glasses that you or I may wear. And the low vision devices, they're very task specific. So you can see when you put those on, they're very blurry.
Yep.
But if you held it up very close, it would be clear.
Okay.
So these are called prismatics. That's just one device. Another might be for a patient who maybe all they won't be able to do is watch you on TV, Carrie. And so they're able to sit in their recliner, place those on, and then see across the room.
Okay.
And so it gives them a little bit of magnification. A lot of the patients that we see have what's called macular degeneration. What that is their central vision is damaged. So they can't see details like faces, reading is difficult. Their peripheral vision is intact. It's wonderful. But the central vision, fine detail, is not so good. So we have to work a lot with magnification to help those type patients.
And so if people wanted to learn more, how do they contact you just to get more information?
Yeah, so our office is Southern Low Vision. We're located in Hattiesburg, and I travel the state of Mississippi. And our phone number is 601-475-2020. They can also contact the Mississippi Optometric Association. They're located in Madison. They can get you information on where to go. As well as if you're not in the Mississippi area, the International Academy of Low Vision Specialists is another really great resource.
All right, Dr. Lott, thank you so much. We appreciate you. We'll be back, Pine Belt.